Armpit lumps can be a cause of concern for many people, as they may indicate anything from a benign issue to a more serious health condition. Simply, armpit lumps are swellings or bumps that develop in or around your armpit area. Your armpit contains many important structures, including lymph nodes, sweat glands, and hair follicles, and problems with any of these can lead to lump formation. Armpit lumps can appear as a single lump or as multiple lumps, and their size can range from tiny pea-sized bumps to larger masses. Types of armpit lumps. There are several different types of armpit lumps, and understanding the differences can help you better identify which type you have. Number 1. Swollen lymph nodes. Lymph nodes are the most common type of armpit lump. These small, bean-shaped structures are part of your immune system and can swell when your body is fighting an infection. When swollen, they might feel firm, tender, and movable under the skin. Number 2. Cysts. Cysts are fluid-filled sacs that develop under the skin. They're usually soft and movable, and they might become tender if infected. The most common type in the armpit is a sebaceous cyst, which forms when oil-producing glands become blocked. Number 3. Lipomas. Lipomas are soft, fatty lumps that grow slowly and feel doughy to the touch. They're usually painless and can move easily under the skin when you press on them. While they might be concerning to find, they're typically harmless. Number 4. Abscesses. An abscess is a painful, pus-filled lump caused by a bacterial infection. Abscesses in the armpit often result from infected hair follicles or sweat glands, leading to swelling, redness, and warmth in the area. Number 5. Fibroadenomas. Fibroadenomas are solid, round lumps that most commonly affect women. They're usually painless and mobile, feeling like a marble under the skin. Number 6. Malignant tumors. Although rare, armpit lumps can be a sign of cancer. Malignant lumps are typically hard, immovable, and may be associated with other symptoms like weight loss, night sweats, or changes in nearby lymph nodes. Breast cancer can sometimes spread to lymph nodes in the armpit, causing a lump that may be one of the early signs of the disease. Causes of armpit lumps. The causes of armpit lumps are quite varied, which is why proper diagnosis is so important. Number 1. Infections. When you have a cold, flu, or other infection, your immune system responds to these infections by enlarging lymph nodes as it filters out harmful pathogens. Bacterial infections of hair follicles or sweat glands can also lead to painful lumps. Number 2. Injury or irritation. Injuries to the underarm area, such as cuts or scratches, can lead to inflammation and swelling. Additionally, skin irritation from shaving, antiperspirants, or deodorants can cause irritation that may result in small lumps or localized inflammation. Number 3. Autoimmune conditions. Conditions like lupus or rheumatoid arthritis can cause generalized lymph node swelling, including in the armpit, as the body's immune response becomes overactive and causes inflammation in various parts of the body. Number 4. Hormonal changes. Hormonal changes can play a significant role, particularly in women. Some people notice armpit lumps that appear or change size during their menstrual cycle or during pregnancy. How to know which type you have. The way an armpit lump feels can vary significantly depending on its cause. When you touch a swollen lymph node, it typically feels like a small, round bump under the skin. These can be tender to touch and might feel somewhat mobile. The area around the lump might feel warm, and you might notice some redness of the skin. On the other hand, cysts usually feel like soft, smooth lumps that move easily under the skin. They're typically painless unless they become infected, in which case they can become red, tender, and warm to touch. If you have an infected hair follicle or sweat gland, the lump usually starts small but can grow larger and become increasingly painful. The skin over the lump might look red and feel hot to touch. These lumps can sometimes develop into abscesses, which are painful, fluid-filled infections under the skin. In rare cases, if the lump is cancerous, it may feel hard, irregularly shaped, and immobile. Cancerous lumps are often painless, but can sometimes cause a dull ache. Lumps that are associated with cancer may also grow over time, and the skin over the area might change in appearance or texture. Some people might experience additional symptoms along with their armpit lumps. You might notice fever, night sweats, or unexplained weight loss if the lumps are related to an infection or other systemic condition. Some people also experience fatigue or a general feeling of being unwell. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of armpit lumps. When you visit a doctor about an armpit lump, they'll start with a thorough medical history and physical examination. They'll want to know when you first noticed the lump, whether it's changed in size, if it's painful, and if you've experienced any other symptoms. During the physical exam, your provider will carefully feel the lump to assess its size, texture, and whether it's mobile. They'll also check for other lumps in your armpit and other areas where you have lymph nodes, like your neck and groin. Depending on their initial findings, they might recommend additional tests. An ultrasound is often used to get a better look at the lump and determine whether it's solid or fluid-filled. In some cases, they might recommend a CT scan or MRI for a more detailed view. If the lump appears suspicious or doesn't go away on its own, your provider might recommend a biopsy. This involves taking a small sample of tissue from the lump to examine under a microscope. The type of biopsy will depend on the characteristics of your lump and your provider's concerns. Treatment for armpit lumps. The treatment for armpit lumps depends entirely on their cause. Many lumps, particularly those caused by minor infections or viral illnesses, will go away on their own with time and don't require specific treatment. For infected lumps, your doctor might prescribe antibiotics. These might be taken by mouth or applied directly to the skin, depending on the type and severity of the infection. If an abscess has formed, a minor procedure to drain the pus may be necessary to relieve pain and speed up healing. As for cysts that aren't causing problems, they can often be left alone. However, if they become infected or bothersome, they might need to be drained or surgically removed. The same goes for lipomas. They can be removed if they're causing discomfort or cosmetic concerns. Home remedies for armpit lumps. If you have an armpit lump and are experiencing discomfort, there are several home remedies that can help alleviate symptoms while you wait for medical evaluation. First, you should practice good hygiene by washing your armpits daily with mild soap and warm water. Be sure to dry the area thoroughly afterward. You should also wear loose-fitting, breathable clothing to reduce irritation and sweating in the armpit area. If your armpit lump is currently tender or inflamed, avoid shaving, as this can irritate the area and potentially introduce bacteria. Wait until the swelling subsides before resuming shaving or switch to an electric razor that minimizes skin irritation. When you do shave your armpits, use a clean, sharp razor and shaving cream to minimize irritation and the risk of infection. Consider trying different hair removal methods if you frequently get ingrown hairs or irritation from shaving. For painful lumps, applying a warm compress can help reduce discomfort and promote drainage if there's an infection. Do this several times a day for 10 to 15 minutes at a time. Finally, if you're prone to getting armpit lumps, consider using an antibacterial soap or body wash. Some people find that using antiperspirants rather than regular deodorants helps reduce the occurrence of lumps. When to talk to a doctor. While many armpit lumps are harmless and will go away on their own, certain situations warrant medical attention. So see your doctor if the lump persists for more than 2 weeks without improving, if it is growing larger, or if you experience significant pain. You should also talk to your doctor if you develop fever or other general symptoms, or if the lump feels hard or fixed in place. Now, we want to hear from you. Have you experienced an armpit lump before? What helped you manage the symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.